Hi, everyone. Thank you so much for tuning in. I'm Alexandra, MDPen's Brand Educator, and today I wanted to talk about the EndyMed in particular when pertaining to the eyes. So the eyes are a very delicate area, and they can be treated with radio frequency. And the EndyMed is an FDA-approved device that we have here at MDPen if you're interested in more information. And they actually call this the EndyEye treatment. And with the EndyEye, you have multiple options, multiple handpiece choices. I also want to focus on the skincare used for the eyes during this treatment. Let's talk about radio frequency for the eyes. So, as everyone knows, the eyes can be one of the areas where people first notice the signs of aging. And there's many reasons for this. When we smile, we sometimes squint our eyes and things like this. But a lot of times, when you're under 18 and perhaps you've had sunburns as a child, you're going to have little bits of hyperpigmentation showing up there, maybe very early signs of crow's feet. And this can all happen in the early and mid 20s. And a lot of times, I find now with younger generations, it's starting to bother people, more early on, and they want to seek treatments. And people, of course, prefer non-invasive, which I totally understand. So many things can bother people about the eyes. There can be, of course, fine lines, wrinkles, dark circles. Maybe you've seen fat pads under the eyes or just overall puffiness. And then you have ptosis, eyelid drooping, and things like this. So there can be challenges there. And a lot of times it's not just one issue by itself, but multiple issues grouped together. I suppose you could also say, hyperpigmentation. I used to have tiny little, sunspots under my eyes from growing up near the beach in Florida. And I don't have them anymore. And I'm able to keep them away by treating preventatively as well. So the challenge with this area, this is a very hard to reach area. And with a handpiece, you need something really small so you can actually get in there. This is some of the thinnest skin on the body, guys. And again, even with skincare, there's only certain products you can use on the upper eyelids. Same thing goes with radio frequency technology. Do use the comments, guys. Feel free to ask questions. I already have the code there if you end up wanting to go shopping for some of these skincare products. But yeah, let's keep talking about the EndyMed RF for the eyes. So here you have the 3 different hand pieces that can safely be used when treating the eyes. On the left there, you have the FSR, which stands for fractional skin resurfacing. I absolutely love this device for fine lines, wrinkles, tissue tightening. Amazing procedure. The middle device you may already be pretty familiar with. This hand piece is going to be called the Intensive, and this is like the classic radio frequency microneedling hand piece. So you can see those micro needles there at the top of the cartridge. And with the eye area, you can get up to about a 1.5 millimeter depth with this handpiece. Whereas with regular microneedling, you're pretty much working at 0.25. I would say even 0.5 can be too high, too strong for the eyes when dealing with a microneedling pen. But with this device and the safety of it and having that heat component, you're able to get to that 1.5 millimeters pretty frequently. Now here on the right, you have the iFine hand piece. So that's like little iFine. And you can see how tiny the hand piece is. And this really gets in there to those delicate eye areas. You're able to get lower lids, crow's feet area, upper lids, eyebrow. This treatment is amazing, the iFine here. And I want to talk more about the iFine in particular, guys. When you buy this EndyMed device, keep in mind with these RF hand pieces like the iFine, as well as the body shaper type treatments, mini shaper, small hand piece, these do not require numbing. And these can be used at the time of other visits and appointments. It's a quick, effective, easy treatment, no downtime, just minimal heating of the skin tissue. It is not uncomfortable. You are measuring the temperature and gauging it as you go. So technically, someone could come in and do this iFine treatment once a week for 4 weeks. And then for the next 2 treatments, this is a series of 6, they would come in at 2-week interval marks. So within 8 weeks, they've completed a series of 6 of these iFine treatments. And this is so amazing for those delicate eyes. Again, this is such a non-invasive treatment. There's no numbing required, super comfortable. With that being said, you can also pair that iFine on the right with one of the treatments on the left, the FSR on the far left, or that middle RF microneedle handpiece, which you've seen us do during our webinars, and we'll be giving you more content on that. And in these situations, you would be doing the iFine first there on the right, and then doing one of those other treatments on the left afterwards. I do see some comments coming in, so I want to get to them. Who are the ideal candidates for RF for the eye? So hopefully I answered this. You should know your contraindications as professionals if you don't already for who is not an ideal candidate, so you can wean those people out. But basically anyone who wants to treat preventatively, anyone who has one of those outstanding issues, fine lines, wrinkles, dark circles, ptosis, lax skin, crepiness, any of these. Some people want to avoid injectables altogether. I personally don't really like having neuromodulators near my eyes for the most part. So I prefer to do a treatment like this. Anyone who's ever had eye filler that they haven't liked, or that they don't want to do eye filler, if they've had neuromodulators that have, given them too much of that like deer in the headlights look that they don't like. There's just so many reasons. And even if you have an amazing injector, who does great filler there, does great neuromodulators, there's still things like the tone, the texture, where you may still want to do the FSR treatment. So really anyone can find a reason to do one of these treatments. I think I answered this one. What treatments can be paired with RF? So honestly, just about anything. Someone could have a facial afterwards. They could have dermaplane, a chemical peel. I mean, they won't be able to come in a week later for their next one. They probably have to wait 2 weeks if they're going to do a chemical peel. But really anyone, if they're already in the office for a body treatment, they can have this done. They don't even have to pair anything with it. This is such a quick, nice lunchtime treatment. It's not going to take up a lot of your day. You can come in once a week, for that half hour, 20 minutes, and get this treatment going. Again, that is a shopping code there for you guys. Let's talk about, once you've done one of these EndyEye treatments, what you're going to use skincare wise. And again, there will be more information on this on tomorrow's Facebook video. But what we have at MDPen is our EndyEye kit, and I want to go over what's in there. So you're going to have our hydrating cleanser in there. I love this cleanser, guys. You guys know that I talk about it all the time. I use this cleanser to take off my eye makeup. I encourage men to shave with it. It foams up without water. I use it directly over my eyes in the evening. I use this when recovering from strong peels, when my skin is cracked, flaking, irritated, 6 hours out from microneedling. This is something you can safely cleanse your skin with. It's more gentle than any gentle cleanser over the counter. And I absolutely love the chamomile and marigold smell it gives off. This one also has HA, snow mushroom, green tea, super hydrating, nourishing ingredients. This is the cleanser that you want as post-care following microneedling or RF microneedling in general. And again, you can safely use this to cleanse the eye area. Fingertips. Our Tighten and Lift Serum. So Obviously, it's in the name, tighten and lift. I love this serum for the jawline, the neck area, around the eyes. This one has that tiny bit of lactic acid in it, which is going to act more as like a hydrating alpha hydroxy acid. It has green tea in it, sweet almond extract, and the oat kernel, which is anti-inflammatory. So this is gorgeous serum to be using around your eyes safely. It has a nice thin consistency. It's so easy to layer. If you have combination or oily skin, you may actually love this as your full face everyday moisturizer. And again, it tightens and lifts, so feel free to use it on the jawline, the neck area, but we do love it in our EndyEye protocol. So cleanser, tighten and lift, and one more, you've got your human-derived growth factor gel. And we, of course, offer it in 2 sizes for retail. We have it in the 3.4 ounce size, and we do have it in that 1 ounce size. So depending what you want to charge for your kit, you can include the large one or the 1 ounce. Now, with this gel, this is safe for the eye area. And when I say the eye area, I mean all of it. So this is a product that is safe for the upper eyelids. There's not many out there that are safe for this area. Again, with eyes, you want to just lightly just use your fingertip, little pats. You can use this all in the crow's feet, the upper lids, all the way up to the eyebrow. All of our products are good for full face. So feel free to wear a full thin layer on your entire face in the evening, but this is an eye safe product. And this is going to help promote collagen. It's going to help with healing, barrier repair, help with your tone, your texture. This, if you're using it nightly, will also offset any, perhaps harsher therapies you're wearing on your skin or prescription strength things. This one is also going to have the snow mushroom and HA in it, which is super hydrating, 540 stem cell human-derived growth factors, very potent, wonderful product for the eyes. So our EndyEye kit is going to have these 3 products in them, guys. And this is what I'm going to recommend for post-care after these RFI treatments. Let me share these links with you. Again, do not forget about that shopping code for your 10% off human-derived growth factor gel, tighten and lift serum, and cleanser. I do see another question. All right, so this is a loaded question. What treatment should be avoided before and after RF? Oh my goodness. Okay, so you don't want to have a sunburn. You don't want to be using any prescription strength vitamin A products, no alpha hydroxy, no beta hydroxy acids. You don't want to have done a strong laser treatment, chemical peel in the last month, no eyebrow waxing, no depilatory hair removal treatments. The list kind of goes on. Hopefully that's helpful, guys. And same is going to go with afterwards. You're going to wait a full week to bring back your retinol, retin-A, retinaldehydes into your regimen, your alpha hydroxy, beta hydroxy, and all of those things. What moisture blends go well? Okay, so you can definitely rewatch this video. I just went over that. Look into our Tighten and Lift serum and our human-derived growth factor gel for the answer to that question. Thank you guys so much for your participation today. Again, these are what those hand pieces look like for the EndyMed. These are 3 hand pieces that can all be used on the eye area. This is such an amazing device, guys. With the EndyMed Pure or EndyMed Pro, you can definitely reach out to MDPen if you are interested in this device and how it can fit into your practice. You may, end up just doing a ton of RF. Again, it's a no downtime, very quick, hassle-free, pain-free treatment, but also know that you can combine it with other hand pieces. So I look forward to talking with you guys more about the eyes this month. Thank you so much for tuning in. I look forward to seeing you next week. Bye.